Welcome to Therapy Facts with Dr. Jenn. We are still on point two of how to start therapy. So, the first video on point two talked about accessing your employee assistance program first as a first step to figuring out how to start therapy. Access the employee assistance program, the personal assistance program, or the student assistance program if you're a university student, in order to find the free services that will be available to you, typically in a crisis intervention format. The second thing you want to do if you are looking to start therapy and maybe there either is no employee assistance program or a crisis assistance program, then you start with your health insurance company. So, again, if you have health insurance which provides mental health services as a benefit, go on your health insurance's website and there should be a list of therapists that are in network that your health insurance will pay some monies toward. And the point of going to see who is in network is to get your hands on actual lists of therapists who hopefully are accepting clients. That's a big deal. So when you start going through your health insurance, you're looking for therapists who are accepting clients. Then once you get your hands on that list, either via website or you may actually have to call your health insurance company in order to get that list so that you can begin to choose. Then what you could do is you could use social media or the internet to do a little search on the therapists that you have names for. One place to do a therapist search, whether you have insurance list or not, is psychologytoday.com. They provide a list of therapists educated at all levels, not just psychologists, but all types of licensed therapists on their website based on location. And so they are a great place to take your list, your health insurance list, and or to just search for therapists in your region. But the thing about the website is that it provides background information about the therapist, and it usually also provides a picture. And so you can see what your therapist looks like if that makes any difference to you. Another way to get access to therapists who may be taking new clients is through referral, through simply word of mouth, to ask people you know who are in therapy, people you know who may be in the mental health field, even people you may know who are in the medical field. So, for example, your primary care provider might be able to make a suggestion or referral about for a good therapist. You also may ask your social media comrades about a referral for a therapist, whether it's somebody that they've known and used or they just know about. So there's a little bit of digging that begins to happen when you begin to look for a therapist, or that you have to go through the process of digging a little bit in order to find a therapist to get started. But the biggest thing I always say to people is hit the easy button. It is better to get started with someone to start the process knowing that you are just starting, that you don't have to stay with the initial therapist that you choose if it's not a good fit. But simply getting started can provide a ton of relief to whatever is ailing you, and also begins to inform you about the process of finding a therapist and all the elements that are involved in how therapy works. So find your list. Like I said, start with EAP, start with your health insurance company, start with psychologytoday.com, and just get started.